All right, ready to jump into this whole C-section thing.
Let's do it.
You guys requested a deep dive on cesareans, and honestly, prepping for this has been eye-opening, even for me.
Oh, totally.
I mean, it's one of those things we hear about all the time, but how much do we really know about what's involved?
Right.
That's what we're here to uncover.
Exactly.
So before we get into the nitty-gritty, I'm curious, how have C-sections changed over time? I feel like they've come a long way.
You're absolutely right. The shift from those big vertical incisions to the more common horizontal ones, the Kerr incision, that's been huge GE for making them safer.
Gotcha.
Especially for future pregnancies. Less risk of uterine rupture down the line. It's a game changer.
So C-section, it's surgery.
Major surgery, yeah.
But why? What are the situations where it's like, okay, we got to do a C-section?
Well, sometimes it's a no-brainer. Like if the placenta is completely covering the cervix, that's placenta previa, or if the umbilical cord comes out first, cord prolapse. Those are emergencies where a C-section is the fastest, safest way to get baby out.
Makes sense. It's like, get the baby out. And
it can be truly life-saving.
Wow. So those are like the clear-cut cases, but are there times when it's less obvious?
Definitely. There are situations where it's more of a judgment call. Like imagine the baby's head is just too large to fit through the pelvis.
Oh, wow.
We call that cephalopelvic disproportion.
Okay.
Or maybe labor just isn't progressing, even with induction.
I see.
So it's about weighing the risks and benefits at that point.
And it's not always just about the baby's safety, right? Sometimes it's for the mom.
You got it. Maternal health is crucial. Our sources mention things like active genital herpes, certain heart conditions, even tumors obstructing the birth canal. It becomes about choosing the best path for both mom and baby.
It's a more holistic picture than I realized.
Absolutely.
Okay, so we've talked about WHYC sections happen.
Right.
But we got to be real here. Right. It is major surgery. And with any surgery, there are risks.
You're not wrong.
What are we talking about here?
Well, there's the possibility of needing blood transfusions, even ICU admission in some cases. Those are immediate concerns.
Oh, wow.
Then longer term, there's the risk of blood clots forming, like DVT or a pulmonary embolism.
I've heard of those, yeah.
And there's even the chance of injury to the bowel or bladder during the procedure.
That sounds intense.
It's serious stuff, no doubt. But modern medicine is incredibly good at minimizing these risks. Surgeons are highly skilled. Hospitals have strict protocols.
That's reassuring.
And often the benefits outweigh the risks, For instance, one source pointed out that babies born via C-section are more likely to have breathing problems right after birth.
Wait, really? I didn't know that. Why is that?
It's because during a vaginal birth, the pressure of passing through the birth canal actually helps squeeze fluid out of the baby's lungs. With a C-section, they don't get that squeeze.
Oh, I see.
So they might need a little extra help clearing their airways at first.
Fascinating. Okay, so let's say someone IS scheduled for a C-section. What should they expect? What does the big day actually look like?
Well, first the prep. You shower with antibacterial soap. Right. Trade your regular clothes for a hospital gown.
Right, the whole glamorous hospital look.
Exactly. And then the monitoring starts. They'll check your blood pressure, temperature, all your vitals, and keep a close eye on the baby's heartbeat, too.
Okay.
Making sure everything's stable.
I bet there's a mountain of paperwork, too, right?
Oh, absolutely. Consent forms are super important. Your doctor should be explaining every detail of the procedure, answering any questions you have.
Yeah.
It's all about informed consent.
Makes sense.
Then comes the IV, which is standard procedure, just in case you need fluids, or a blood transfusion during or after the surgery.
Okay.
And a catheter as well. Not the most comfortable thing, but it keeps your bladder empty during the procedure.
I can imagine.
Then there might be some shaving of the pubic area, though I've heard some hospitals are moving away from that.
Interesting.
And you'll get some pre-op meds. Antacids to prevent stomach acid from getting into your lungs. And antibiotics to prevent infection.
So all that, then you head to the OR.
Pretty much.
Okay, talk me through that. What's the OR like?
Well, you'll be positioned on the operating table, and then they give you spinal anesthesia, which numbs you from the waist down.
Gotcha.
So you're awake the whole time, but you don't feel any pain.
I think I'd prefer that.
Probably. The anesthesiologist will be there the entire time, monitoring your vitals and keeping you comfortable. They'll be monitoring baby's heartbeat, too.
Gotcha.
And speaking of the medical team, nurses play a huge role in the OR.
What do they do?
So much. They'll help position you on the table, make sure the fetal heart monitor is working, check the suction equipment, And even make sure you have those SCDs on your legs.
SCDs.
Those are inflatable leg wraps that prevent blood clots from forming during surgery. They're super important. Think of the nurses as the behind-the-scenes heroes, making sure everything runs smoothly.
That's amazing. Okay, so you're prepped, you're numb, the team's ready. What happens next?
The surgeon makes the incision, and then before you know it, you hear your baby's first cry.
Aww.
It's pretty magical, even amidst all the medical stuff.
I can imagine. So, baby's here. What happens in those first few moments?
Skin-to-skin contact is a priority.
Ooh, good.
They'll encourage you to hold your baby as soon as possible, even start breastfeeding right there in the OR if you can.
That's so sweet.
It's all about bonding and that parent-child connection.
I love that. So fast forward a bit.
Yeah.
What's recovery like after a C-section? It's got to be more than a few stitches, right?
Oh, it's definitely a process. Once you're in the recovery room, they're monitoring your vital signs constantly, making sure there's no excessive bleeding.
Okay.
And they'll be gently massaging the top of your uterus.
Why is that?
It helps it contract back down and prevents hemorrhage.
Oh, wow.
And you'll be getting IV pitocin, which is synthetic oxytocin. It helps the uterus contract and reduces bleeding as well.
Okay, so what's it actually like in those first few hours after surgery?
Well, prepare to crave ice chips.
I can see that.
They'll be listening for bowel sounds and asking if you've passed gas.
Wait, what?
Yep, that's how they check if your digestive system is waking back up.
So passing gas is a good thing in this scenario.
It is. It means things are moving in the right direction.
Good to know. What else happens during recovery?
The nurses will be encouraging you to get up and walk around as soon as you're able.
Jeez, that soon?
Yep. Moving around helps prevent blood clots and speeds up healing.
Huh. Never would have thought. Okay, so I'm getting a better picture of recovery now. But what about women who want to try for a vaginal birth after having a C-section? Is that even possible?
It can be. It's called TILOLAC, trial of labor after cesarean, or VBAC, vaginal birth after cesarean.
Okay.
But it's not something to take lightly. There are specific criteria that need to be met to make sure it's safe.
I see. Like what?
The biggest thing is the type of incision from the previous C-section. It needs to have been a low transverse incision, the horizontal one, and your pelvis needs to be large enough to allow for a vaginal birth, and no history of complications like cord prolapse or placenta previa in previous pregnancies.
So it depends a lot on your individual situation.
Exactly.
And inducing labor, is that tricky with a VBAC?
It can be. Inducing with pitocin carries a slightly higher risk of uterine rupture.
Okay.
And things like prostaglandins, they're usually off limits for VBACs because they can increase that risk even more.
Oh, wow.
It's about minimizing risks wherever possible.
So what about the overall risks with TOLAC, VBAC? What should people be aware of?
The biggest concern, and the one that usually leads to other complications, is uterine rupture. That's when the scar from the previous C-section tears open during labor.
Oh gosh, that sounds scary.
It can lead to serious bleeding, maybe needing blood transfusions, sometimes even an emergency hysterectomy to stop the bleeding.
Oh no.
There's also a risk of needing to go to the ICU.
Wow, those are some serious risks.
They are. And unfortunately, it can pose a risk to the baby's well-being, too.
So, with a TOLAC VB, what kind of monitoring and management can someone expect?
It's all about vigilance. Continuous fetal monitoring is crucial, and you'll have IV fluids and usually a clear liquid diet.
Okay.
The medical team will be watching your vital signs and contractions super closely, ready to step in if anything seems off.
So it's like a delicate balance of supporting a vaginal birth, but being prepared to intervene if needed.
Exactly. Mom and baby's safety is the top priority.
That makes sense. Wow, we covered a lot.
We did.
We went from the history of C-sections to the reasons behind them, the risks, the whole experience, and even VBACs.
It's a lot to unpack, that's for sure.
It is. But before we move on, I want to take a minute to think about the emotional side of things.
Oh, absolutely.
We talked a lot about the medical stuff, but a C-section is more than just physical, right?
It's a huge life event. It comes with a whole range of emotions.
I imagine there are some complex feelings involved. Like, what if you were really hoping for a vaginal birth and ended up needing a C-section? Could that lead to disappointment or even a sense of failure?
For sure. And it's so important to acknowledge and validate those feelings. It's okay to grieve the birth experience you didn't have, even while you're celebrating the arrival of your baby.
That's important to hear.
It really is.
And it's not just the emotional impact of the birth itself. C-section recovery can be tougher physically too, right? More pain, less mobility. All of that can make bonding with your baby and adjusting to motherhood even harder.
Absolutely. Support from partners, Family, friends, everyone is so crucial during this time. And healthcare providers need to address both the physical and the emotional aspects of recovery.
Right. It's not just about healing the incision.
It's about healing the whole person.
I remember reading that having a doula present during a C-section can be really helpful.
Oh, definitely.
I used to think doulas were only for vaginal births, but it makes sense that they could be supportive during a C-section too.
They can provide emotional support, advocate for your wishes, even help with things like breastfeeding and newborn care in the recovery room.
It's like having an extra advocate by your side.
It is. It's about creating a more positive and empowering experience, no matter how your baby is born.
That's so valuable. So we've covered the medical reasons for C-sections, the risks, the emotional considerations, but what about the long-term effects? Are there any implications that we might not see right away?
That's a fascinating question. There's emerging research suggesting that babies born via C-section might have a slightly higher risk of developing certain health conditions later in life.
Really? Like what?
Well, things like asthma, allergies, even obesity have been linked to C-section births in some studies.
Wow, I had no idea. Why would that be?
It's thought to be related to the microbiome, the community of bacteria that live in and on our bodies.
Oh, right.
During a vaginal birth, the baby gets exposed to the mother's vaginal and fecal bacteria.
Oh.
It helps colonize their gut and develop their immune system.
So they get a dose of good bacteria on the way out.
Exactly. But with a C-section, that exposure is different.
I see.
And it might have long-lasting effects, even subtle ones.
That's wild. It shows how much we're still learning about the human body and how birth impacts lifelong health.
It really does. This research underscores the need for ongoing studies and discussions about birth practices and their potential impacts on future generations.
So we've talked about the individual experience,
Yeah.
But what about the bigger picture? What's the global view on C-section rates?
That's a crucial aspect. C-section rates vary dramatically around the world, which tells us a lot about different healthcare systems, cultural norms, and even socioeconomic factors.
Right. It's not just about medical decisions.
Exactly. Remember how the World Health Organization recommends C-section rates should ideally be around 10-15%?
Yeah.
Well, that's not always the reality.
Not at all. I mean, the U.S. is over 30%, and in some Latin American countries, it's nearly 50%.
It's true.
What explains such a huge difference?
Well, advancements in medical technology are definitely part of it. The easier it is to perform C-sections, the more likely they are to happen.
Makes sense.
And then there's the concern about defensive medicine.
Defensive medicine.
It's the idea that doctors might choose C-sections to avoid lawsuits.
Wow.
Even in situations where a vaginal birth might be possible.
So fear of being sued is driving medical choices.
It's a factor, unfortunately. It highlights the need for better communication and shared decision-making between doctors and patients.
That's kind of a scary thought.
It is.
Yeah.
And it emphasizes the importance of finding a balance between using new medical advancements and respecting what each person wants for their birth.
Right. It's not just about the medical side.
Absolutely. And let's not forget about cultural influences.
Oh, right.
In some cultures, C-sections are seen as a sign of status or wealth.
Interesting.
Or they might be considered the easier option.
So it's this whole mix of medical stuff, legal concerns, cultural beliefs, personal preferences.
Exactly. It's complex.
It really is. And it makes you wonder,
Yeah.
Are we overusing C-sections in some parts of the world? And if so, what does that mean for mothers and babies?
Those are big questions. It all points to the need for a balance, making sure C-sections happen when medically necessary, but also respecting individual choices and preferences.
Finding that middle ground is key.
Absolutely.
All right, we've covered a ton in this deep dive.
We have.
But it feels like we're just getting started. There's so much more to explore when it comes to C-sections and birth choices in general.
Definitely. It's a topic that deserves ongoing research, open discussions, and careful thought from everyone involved.
Well said. We'll be back soon with more on C-sections.
It really makes you think, doesn't it? How do we make sure women everywhere have access to safe and informed births, whether it's vaginal or a C-section?
That's a big one. Where do we even start?
Well, I think education is key.
Yep.
Giving women the knowledge to understand their options, the risks, the benefits, so they can make informed choices.
I like that, informed choices. But it's not just about individual knowledge, right? It feels bigger than that.
You're right. There are systemic issues, too. We need to address things like affordability, access to skilled birth attendants, and even cultural beliefs that can impact decisions.
It's like this whole web of interconnected factors.
Exactly. It's complex, and it needs a multi-pronged approach.
So we need individual empowerment, A&D systemic change. That's a tall order.
It is. But it's essential if we want every woman to have a safe and positive birth experience, regardless of their circumstances.
This whole conversation has really made me realize childbirth is way more nuanced than I thought. It's not just vaginal versus C-section. There's so much more to it.
You got it. And remember, there's no one-size-fits-all approach. Every birth is unique, and what matters most is a healthy mom and baby.
Well said. Okay, so something I'm curious about that we haven't really touched on yet.
Yeah.
What about the long-term effects of C-sections? Are there things that might not show up right away?
That's a great question, and it's an area of ongoing research. Some studies suggest that babies born via C-section could have a slightly higher risk of certain health conditions later on.
Oh, really? Like what kind of conditions?
Well, there's been some links to things like asthma, allergies, even obesity.
Wow, I had no idea. Why would that be?
The current thinking is that it's related to the microbiome.
The what?
The microbiome. It's that whole community of bacteria that live in and on our bodies.
Right.
So during a vaginal birth, the baby is exposed to the mother's vaginal and fecal bacteria, and that actually helps to colonize their gut and develop a healthy immune system.
So it's like they get a dose of good bacteria on their way out.
Exactly. But with a C-section, that exposure is different, which might have some subtle but long-lasting effects on their immune development.
It's amazing how interconnected everything is.
Isn't it? It just shows how much we're still learning about the human body and how birth can have these long-term impacts on health.
So where do we go from here? What can we do to make sure C-sections are used appropriately?
I think it's got to be a multi-pronged approach. We need to keep researching the long-term effects so we understand the risks and benefits better. We also need to educate healthcare providers, and the public, about the guidelines for C-section use.
Right, so everyone's on the same page.
Exactly, and encouraging open communication between doctors and patients so they can make decisions together.
I like that. Shared decision-making.
Yes, and we can't forget about those socioeconomic factors that can make access to good care uneven.
Right, it's all connected.
It is. We need to work on all these fronts to create a system that supports informed choice and prioritizes the well-being of moms and babies.
It sounds like a big task.
It is, but it's an important one.
Okay, so we've talked about the medical reasons for C-sections, the risks and benefits, even the emotional considerations. We've even touched on the global perspective.
A lot to take in.
It is. But before we wrap up this part, I want to go back to something we mentioned earlier.
What's that?
The emotional side of things. We focused a lot on the medical aspects, but let's not forget the human experience. A C-section is a major life event, and it can be really emotional for the mother.
You're so right. The emotional recovery is just as important as the physical recovery.
Absolutely. Like, imagine you were really hoping for a vaginal birth and ended up needing a C-section. It seems like there could be a lot of disappointment there.
Oh, definitely. And maybe even a sense of failure.
Exactly.
It's so important to acknowledge and validate those feelings. It's okay to grieve the birth experience you didn't have, even while you're celebrating the new baby.
That's such an important message.
It really is. And sometimes a C-section can feel like a loss of control, which can be hard to cope with.
And the physical recovery can be tough too, right? Pain, limited mobility. All of that can make it harder to bond with your baby and adjust to motherhood.
You're right. Having support from partners, family, friends is so important during that time. And healthcare providers need to be addressing the emotional side of recovery too, not just the physical.
Yeah, it's about the whole person.
Exactly. And something I think is really helpful is having a doula present during a C-section.
Oh, interesting. I always thought doulas were only for vaginal births.
They are amazing for those too.
Yeah.
But they can be incredibly helpful for C-sections as well. They can provide emotional support, advocate for you, and even help with things like breastfeeding and newborn care in the recovery room.
So it's like having this extra layer of support throughout the whole experience.
Exactly. It can make a huge difference.
I love that. Well, this has been such an eye-opening conversation.
It has.
I feel like I've learned so much about C-sections, both the physical and emotional aspects.
Me too. It's a complex topic, and it's important to keep these conversations going.
I agree. Well, we'll be back soon to wrap up our deep dive on C-sections with a final look at some of the bigger issues surrounding them. All right, welcome back to the final part of our deep dive into C-sections. We've covered a lot of ground already, why they happen, the risks and benefits, recovery, the emotional side of things, even VBACs.
Yeah, we've been through a lot.
We have. But before we wrap up, I wanted to circle back to something you mentioned earlier, those really different C-section rates around the world.
Oh, yeah, that's a fascinating topic.
It is. Remember, the World Health Organization says C-section rates should ideally be between 10 and 15%.
Right, but that's not the reality everywhere.
Not at all. Like, here in the U.S., it's over 30%. And in some parts of Latin America, it's almost 50%.
It's wild, right? So many factors contribute to those differences.
Yeah, like what's going on?
Well, advancements in medical technology are definitely part of it. As C-sections become safer and more accessible, they're more likely to be performed, even in situations where a vaginal birth might be possible.
So it's like, if you have the technology, you're going to use it.
Kind of. But it's not just about availability. There are concerns about what's called defensive medicine, too.
Defensive medicine?
Yeah, it's the idea that doctors might choose to do a C-section to avoid potential lawsuits, even if it might not be absolutely medically necessary.
Wow, so they're worried about getting sued.
Exactly. It's a complex issue, but it definitely highlights the importance of communication and shared decision-making between doctors and patients.
Makes sense. And what about cultural beliefs? Do those play a role too?
Absolutely. In some cultures, C-sections are seen as a status symbol, a sign of wealth or modernity.
Huh, interesting.
And sometimes they're seen as the easier or more convenient option, which can definitely influence choices.
So it's like this whole mix of things, medical stuff, legal concerns, cultural beliefs, personal preferences.
Exactly. It's a complicated picture.
It really is. And it makes you think, are we overusing C-sections in some parts of the world?
It's a big question. And if so, what are the implications for moms and babies?
Yeah, that's a big one. What can we do to make sure C-sections are being used the right way?
I think it needs a multi-pronged approach. First, we need more research into the long-term effects of C-sections to get a better understanding of the potential risks and benefits.
Okay, makes sense.
And we need to educate both healthcare providers and the general public about evidence-based guidelines for C-section use.
So everyone's on the same page and making informed decisions.
Exactly.
Yeah.
We also need to encourage those open and honest conversations between doctors and patients, making sure decisions are made together, considering individual preferences and circumstances.
Right, like that shared decision-making we talked about earlier.
Yep. And we can't forget about those socioeconomic factors that often lead to differences in C-section rates. We have to address those too.
So it's about creating a system that supports informed choice, respects individual preferences, and makes sure moms and babies are doing well.
You got it.
Wow, this has been quite a deep dive into the world of C-sections.
It has.
We've gone from the individual experience all the way to the global landscape. It's been so eye-opening.
I agree. We've examined the medical side, the emotional side, and even the ethical questions surrounding C-sections.
And we've highlighted how important research, education, and open communication are.
It's all connected.
It really is. Well, that brings us to the end of our deep dive on cesarean births. We hope you've learned something new, maybe even challenged some of your assumptions about childbirth.
Absolutely. We encourage you to keep learning and thinking critically about these issues.
Thanks for joining us, and we'll see you next time on The Deep Dive.